Hi, I'm Lauryne Davis.
And I'm Martucci.
Before we start the video, do I have your permission to touch your shoulder throughout the course of this video?
Yes. And do I have permission to touch your shoulder throughout this video?
Yes. Before we start, it's always important to go through a medical history. And when dealing with the shoulder, you want to ask about previous injuries. You want to ask if they've ever dislocated it, if they've ever hear any noises, if there's discoloration or swelling in the shoulder, and also what kind of pain they're experiencing.
Perfect.
Alright, we will be starting with our bony palpations, and our first one is the clavicle, which I'm palpating the clavicle right now, and I will actually just follow it right up into the AC joint here.
Alright, the next bony palpation we have is of the scapula. So Lauryne, I'm going to ask you to just go ahead and move your hand or move your arm up behind your back like that. And as you can see, we see the definition of her scapula. Just palpating it right down this side, down here, and back up.
Next, I will be palpating the greater tubercle of the humerus. This can be easily palpated by passively extending the humerus and causing the greater tuberosity to move beneath the acromion process. So here is her greater tubercle.
Alright, the next bony palpation we have is of the bicipital groove. So Lauryne, I'm going to go ahead and ask you to externally rotate your humerus. This just makes the bicipital groove more palpable. So the groove is located just medial to the greater tubercle of the humerus, which would be right here. You can feel the indentation.
Next, I will be palpating her deltoid tuberosity. So her deltoid, and it's like right here. It is going to be tender upon palpation.
Alright, moving on to soft tissue palpation. The first one we have is the sternoclavicular ligament, which is located right here at the SC joint space. So it's right in between and it connects the clavicle to the sternum.
Alright, the next thing we'll be palpating is the coracoclavicular ligament. And so that one is going to connect the clavicle to the cornoid here. And so it runs like here.
Alright, moving on to muscles. First we have the pectoralis minor. So the origin is in the anterior medial surfaces of ribs 3 through 5, and its insertion is in the coracoid process of the scapula. Innervation, it is innervated by the medial pectoral nerve, and the action is to depress the shoulder and protract the scapula.
Alright, next we'll be looking at the biceps. So for the origin of the long head, it's the supraglenoid tuberosity of the scapula, and for the short, it's the coronoid process. And then its insertion is down here at the radial tuberosity. It's innervated by the muscular cutaneous, and its roots are C5 and C6. Its action is in flexion because the long head tendon crosses the glenohumeral joint. The bicep brachii also has the action at the glenohumeral joint as an accessory flexor of the humerus, and it also helps in abduction.
Alright, the next one we have is the anterior head of the deltoid. So the origin is in the lateral 1/3 of the clavicle, so we're starting up here, and it inserts down at the deltoid tuberosity. So right down to here. Innervation is auxiliary, the roots C5 and C6, and action is flexion, abduction, horizontal adduction, and internal rotation.
Next we will be doing the posterior head of the deltoid. So the origin is back here on the spine of the scapula, and the insertion is the deltoid tuberosity. It's innervated by the auxiliary nerve. The roots are C5 and C6, and its action is extension, horizontal abduction, and external rotation.
Alright, the next muscle we're looking at is the latissimus dorsi. Its origin is in the spinous processes of T7 through L5 and posterior of the iliac crest. So insertion is the bicipital groove of the humerus. Innervation is thoracodorsal nerves, roots C6 through C8. And the action is it extends the humerus, depresses the scapula, adducts humerus, and medially rotates the humerus. So that's all this.
Next we'll be palpating her supraspinatus, which is here. Its origin is the supraspinatus fossa of the scapula, and its insertion is the greater tubercle of the humerus. It's innervated by the suprascapular nerve, roots C5 and C6. Its action is it initiates and assists in shoulder abduction and assists in the stabilization of the glenohumeral joint.
Alright, the next muscle we're looking at is the infraspinatus. So the origin is in the infraspinous fossa. Alright, the next muscle we have is the infraspinatus. So the origin is at the infraspinous fossa on the dorsal surface of the scapula. Its insertion is at the greater tubercle of the humerus. So it goes right up like this on the medial facet. Innervation, it is innervated by the suprascapular nerve at roots C5 and C6, and its action is lateral rotation of the humerus. It assists in the stabilization of the glenohumeral joint as well.
Alright, next we will be talking about the triceps. There are 3 parts. There's the long head, the medial head, and the lateral head. The long head goes to the infraglenoid tubercle of the scapula, and the lateral head, its insertion is above the radial groove, posterior humeral surface, and the medial head is below the radial groove, posterior to the humeral surface, and the insertion is the olecranon process of the ulna. It's innervated by the radial nerve, roots C6 through 8, and the long head is innervated by the axillary nerve. The action is it's the primary extender forearm at the elbow joint. The long head extends and abducts the arm at the shoulder joint.
Alright, moving on to muscle testing. The first one we have to do is the anterior delt. So Lauren's going to go ahead and passively abduct her arm. Perfect. I'm going to stabilize the joint up here and apply resistance down here. Well, first we'll go through actively. Good. Now we're going to perform the muscle test where I'm going to put resistance down here and she's going to continue to try to abduct her arm against me. Ready, and go. Okay, and now a brake test. We're going to put it about midway and she's going to try to resist the force that I'm putting against it. Ready, and go. Good. 5 seconds.
Next we will be testing the bicep, the long head, and the short head. So I'm going to have Haley bend her arm here, and I'm going to have her bring her arm up and then back down. Alright, now I'm going to add resistance to that. So ready? Go ahead, do it again. Good. Now we're going to do a brake test, so we'll put it halfway, and I'm going to move around a little bit here, and I'm going to hold her for 5 seconds. Ready? Go. 1, 2, 3, 4, 5.
Alright, the next muscle we're going to be testing is the trapezius, the upper portion of the trapezius. So Lauren's going to go ahead and passively shrug her shoulders up and down, just like that. I'm going to apply resistance to the superior aspect of her shoulder right up here, and she's going to do the same thing for the muscle test. Ready? Go. Good. Okay, the next we're going to do a brake test, kind of place her in the middle there, and I'm going to apply resistance for 5 seconds. Try not to let me move you. Ready? Set, go. Good job. Alright, the next muscle we're testing for is pectoralis major. So Lauren's going to abduct her arm up to 90 degrees, and then we're going to do a horizontal adduction towards her over, passively just like that by herself. First thing we're going to do for muscle testing, I'm going to stabilize the joint up here, grab here. We're going to perform a muscle test where she's going to resist the force I'm applying against her. Ready? Set, go. Good job. Now we're going to perform a brake test. We go right in the middle, and for 5 seconds, try not to let me move you. Ready, and go. Good job.
Next we will be muscle testing the teres minor as well as the infraspinatus. So I'm going to have her put her arm up like this, and now I'm just going to have you bring your arm backwards. Alright, perfect. Now I'm going to add resistance. Okay, so ready? Go. Same thing. There you go. Good. Now we're going to do a break test, so about halfway. Don't let me push down. 5 seconds. Ready? Go. 1, 2, 3, 4, 5. Good.
Right, the next muscle we're testing is the serratus anterior. So Lauryne is going to go ahead and flex your arm up straight in the air, just like that. She's going to passively just shrug her shoulder or protract forward just like that and come down. Now I'm going to help her. We're actively going to go through the motion. Go ahead, up and down. And now with resistance for a muscle test. So ready, set, go. Good job. And now a break test. Get at the halfway point, and now try not to let me move you. Ready, go. Good job.
Next we'll be testing the latissimus dorsi. So to do this, I'm going to have her put her arm up like this. Now bring it down to your side. There you go, and back up. Now I'm going to add some resistance while she does this. So ready, go. There you go. Now we'll put it about halfway, and we're going to do a break test. So do not let me pull your arm up. Ready, go. 4, 5.
Alright, the next muscle test we're moving into is for the middle and lower trapezius muscle. So Lauryne's going to start with her arm down here. I'm going to place my hand up on her scapula, and then one hand down here for resistance. She's passively by herself going to just raise her arm up right in front of her and back down. Good. Now we do the muscle test, so I'm just going to place resistance right here. You go ahead and go through that same motion. Ready, set, go. Good job. And then one more at the break test, right in the middle. 5 seconds. Ready, set, go. 4, 5. Good job. Moving on to fracture testing, we're using a tuning fork today. So on Lauryne's clavicle, just go ahead and place this right here. A positive test would be pain. You can use this on any bones, but if there is a suspected fracture, do not use it at the site of the fracture.
For our first goniometric measurement, I'm going to look at extension. So I'm going to line the axis up with her humeral head here, and so it's about just straight. And then I'm going to ask her to move her arm backwards, and I'm going to follow her humerus here, and so that's about 40, and then I get about 15 more degrees when I move her arm back.
Alright, our next range of motion test is for external rotation. So Lauryne's laying supine with her arm up at 90 degrees. The stable level arm gets placed right against her arm here, and then I'm going to ask her to go ahead and externally rotate your arm backwards. And the movable level arm follows it. She hits about 80 degrees of motion, and then with assistance, actively, she gets another 20 degrees of motion.
Alright, our first special test we're going to do is the O'Brien's test. This is going to look for a slap lesion and possibly an AC pathology. So to do this, I'm going to have her put her arm out at 90 degrees in an empty can position. And now I'm going to have you rotate your hand up to a supine position. Alright, now we're going to have you go back down, and we're going to do a break test, okay? So I just need you to hold it there. We're going to do it for 10 seconds, okay? Ready? Go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So if she does have pain with that one, then it's a positive for the slap lesion. And we're going to do the same here. Ready? Go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So for that one, if it's positive for the empty can but not for the supine, then it's positive for a slap lesion. And if it's opposite, it could mean that there is an AC pathology.
Alright, the next test we have to do is the Hawkins-Kennedy test, which tests for impingement. So Lauryne's just going to lift up her arm 90 degrees on the scapular plane. I'm going to place my hands on her wrist and on her elbow here, and then apply medial rotation until pain is found, or you can observe the rotation of her scapula.
The next special test we're going to do is the supraspinatus test, and this tests for rotator cuff impingement. To do this, I'm going to have her put her arm out. We're going to go about 30 degrees in the scapular plane, so just about here. and I'm gonna have her in the open can position. So I'm gonna do a break test for this one. So I'm gonna put my hand up here at the joint, and I'm gonna hold her wrist, and we're gonna do this for 10 seconds. I'm gonna push down, you wanna push your arm up towards the ceiling. Okay, ready, go. 1, 10. So if it was a positive here, she would not be able to fully hold her arm up while I perform the break test.
Or it'd be painful. Alright, the next special test we have to do today is the Adson's test, which is testing for thoracic outlet syndrome. So either sitting or standing, the patient is going to be abducting their shoulder back 30 degrees. But I'm first going to find her pulse, her radial pulse. Make sure I can feel it there. She's going to take a deep breath. She's going to look down, and her arm is going to go back for 30 degrees abducted. I'm feeling that she's just maintaining that pulse so that it not weakens, and bringing it back just to make sure that it is staying consistent. So a positive test for this would be that the pulse either diminishes fully or weakens as she goes back. But in order for this positive test to really say anything about thoracic outlet syndrome fully, you would have to test positive on the other thoracic outlet syndrome test as well.
You can also be tingling in the hands.
Yes.
The next test we're gonna do is the military brace. It also is looking at the thoracic outlet syndrome. So for this one, gonna find her pulse, but not with my thumb. Okay, I found him, so I'm gonna have her tilt your head backwards and look up towards the ceiling, and I am gonna just pull her arms back. I'm still finding the pulse. It's not diminished. So if there is a positive and you do feel the pulse diminishing as you pull back, it's the subclavian artery and the lower trunks of the brachial plexus that are being blocked. By the way, military brace, you also have to have a positive of another thoracic outlet syndrome test because you can get false positives.
Alright, the next special test we're getting into is the Grind test, which is testing for a slap lesion. So Lauryne is going to abduct her arm 90 degrees and flex the elbow 90 degrees. I'm going to grab her elbow down here and the other hand up at her wrist, and I'm going to push in while internally and also externally rotating the glenohumeral joint space. And a positive would be pain, popping, clicking, or any discomfort.
Alright, next we will be doing the pec minor contraction test. So for this, I'm going to have her cross her hands up on her chest, and I'm going to look and see if her scapulas are laying flat, and they are. And if they aren't, you can always sort of push down the arms, and if they continue to go, then you do not have tight pectoralis minor muscles. But if you cannot compress the shoulders back down on the table, they are tight.
Alright, the last special test we have to do is the drop arm test for rotator cuff tendinopathy. So Lauryne is going to be standing. She's going to open can and lift her hand. You're good.
I'm on video.
You
Yeah.
are. This is going to make our video viral now, right?
She's going to lift her arm up, open can, all the way up by her ear, and then we're going to see if she can control her arm coming down just this side. So a positive test would be pain or the inability to control the arm coming down.
This test's for rotator cuff tears. No.
Yes.
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 And rotator. So for our ligamentous testing, we are going to do the AC traction test, looking for AC ligament sprains. So I'm going to hold her shoulder, and I'm going to pull down on her arm, looking for pain.
No.
Okay, good.
Alright, the next test we're doing is the AC compression test, which is testing to see if there's any damage to the AC ligament. So I'm going to put one hand on the anterior surface of her clavicle up here, and the other one back at the acromion process, and just compress this together. No pain, then it's not a positive. All right, continuing the dermatome testing for the sensory issues, we're going to move on to C7. So, Lauren, just go ahead, close your eyes, look away. Let me know when you feel this. Yep, that one's right on her middle finger for the radial nerve. Then moving on to C8.
Now. Yep.
Good, that is the medial 2 fingers there for the ulnar nerve. And then the last one for T1.
Yep.
That is testing for the medial brachial cutaneous nerve.
Next, we will be doing some dermatome testing. So first I'm going to look at C4, the subclavian nerve. So Haley, please close your eyes and look away. Tell me when you feel this.
No.
So this one you're going to do up in this area. Next we'll be looking at C5, the proximal lateral brachial. So we're going to go up in this general area. Please close your eyes, look away, and tell me when you feel this.
No.
And then we're going to do C6, the lateral antibrachial cutaneous nerve, thank you. And that's going to be over in this area. So close your eyes, look away, and tell me when you feel this.
No.
So you do sort of want to, you don't want to do it right away. You want to give them a second so then you actually know that they aren't just saying now and they actually do feel it. So for this one, you want to do it bilaterally and you want to make sure that it's just one side because if it is both sides, it can be a different problem, such as your spinal cord. All right, so now we're going to do some myotome testing. We're going to look at C4 and the dorsal scapular nerve. So for this one, we're going to do a break test. So you're going to have her shrug her shoulders about halfway. And we're going to do this for 10 seconds. I'm going to push down and you're going to push up. Okay, ready? Go. 1, 2, 9, 10. And then we will move on to C5. We're looking at the axillary nerve. So I'm going to have you bring your arm up here, and I am going to push down. You're going to push up. Don't let me push your arm down. Ready? We're going to do this for 10 seconds as well. Ready? Go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. And for the last one, we're going to do the same thing, but I'm going to have you put your hand up like supine, like you're holding a bowl of soup. Okay, ready? Go. 8, 9, 10. Good.
All right, moving on, we have the C7 root. We're testing the radial nerve, so I'm going to place one hand up here. We're going to just flip this up, and I'm going to be pushing up while you're resisting downwards for 10 seconds. Ready? And go. Good job. Now moving on, we're going to do C8, which is the median nerve. So go ahead and put your thumb and your pinky together. And now I'm going to try to open these for 10 seconds while you try to keep them closed. Ready? And go. Good job. And then the last one we have to do is for the T1 root. It's for the medial brachial cutaneous nerve. So fingers out like this, just stretched out. You're going to try to keep these two fingers apart as I push in. Ready? And go. Good job.
Our situation is a 25-year-old male weightlifter who was in the gym and as he was lifting, tore his bicep. So he has a bicep brachii rupture, and so he doesn't have any histories that would cause this. It just sort of happens. But signs and symptoms would be a lot of ecchymosis because the muscle is so vascular, and also edema.
There's also a possibility that the tendon may bunch up or cause a deformity visible on the bicep brachii as well. And he would fail any muscle testing that would be performed on the brachii or the bicep brachii as well.
He's also going to have trouble supinating.